Hello, hello, and welcome back to our viewers for our last panel this afternoon, evening, wherever you are in Canada, and or if you're joining from another part of the world. Thank you for just being here. I have the pleasure to introduce you to the next panel, Not Enough to Be a Game Changer, Perspectives of Disabled People on the Canada Disability Benefit, a suspected policy failure. This panel is being moderated by Dr. Tracy Smith-Carrier with Alfiya Battalova, Lauren Touchant, Sid Frankel, Melissa Brideau, and Laura Cattari. Dr. Smith-Carrier, thank you, and I turn it over to you.
Thank you very much. I think we were going to do actually a little bit more of an in-depth introduction. So perhaps I'll start. I'm Tracy Smith-Carrier. I'm a professor and Canada Research Chair in Advancing the United Nations Sustainable Development Goals at Royal Roads University. And it's a pleasure to be with you today. I'll hand it over to my colleague, Sid.
Hello, everyone, and I'm really impressed that a lot of you are still with us at this hour. Sid Frankel, Senior Scholar in the Faculty of Social Work at the University of Manitoba, kind of retired after about 30 years of teaching and researching there, and very happy to be here to talk with you about this. And Alfiya, you're on.
Thank you so much. Hello, everyone. My name is Alfiya Battalova. I'm an assistant professor at the School of Humanitarian Studies at Royal Roads University. My background is in disability studies. I do a lot of research in this area, and I used to work in a nonprofit sector, disability nonprofit sector. So this kind of work is very close to me. So thank you all for staying on. Yeah, over to you, Tracy.
Let me just make sure that I'm able to there we go. Are we seeing the proper slides?
I think you need to just swap displays.
Swap displays. Better?
Yes.
Yeah, there you are.
Perfect. All right.
All right. Well, let me get started. And I just wanted to give you a bit of a background of how we envision this work. So Tracy and I are both interested in policies. So when Canada disability discussions around Canada disability benefits started happening, we really wanted to understand what are the perspectives, the experiences of people who will be potentially future recipients of the Canada Disability Benefit. And so that's how we came to this project. And then we were lucky to be joined by Sid and other colleagues, including the advisory committee that we were lucky to have to sort of help us sharpen our questions and dive deeper on some of the areas of this work. And so in today's presentation, we wanted to give you a bit of the background of Canada Disability Benefit and kind of look at the some of the maybe a little bit of theory, not too much theory, it's getting late, but I think just wanted to give you a sense of what informed our work, the kind of methods we used, who our participants were, and talk about, of course, the findings and implications moving forward. Next slide, please. And we have a publication, forthcoming publication in the Canadian Journal of Disability Studies. So we hope you'll be able to read it once it's out. And so the purpose of our study was as I mentioned, to explore the perspectives of disabled Canadians on the implementation, design and implementation of Canada Disability Benefit. And more specifically, we were interested in understanding how adequate it is, how fair it is, accessible, in terms of whether it's meeting the stated goals. We also wanted to see how this discussion contributes to broader issues around poverty reduction and social justice in Canada. Next slide. And so to give you a bit of a background, and I'm sure it will not be a surprise to many of you, but we know that people with disabilities experience much higher poverty rates than non-disabled Canadians. And I will show you some numbers on the next slide. And economic and social marginalization is further exacerbated by the intersectional experiences. So people who are members of the racialized groups, who have intellectual disabilities, LGBTQ individuals are experiencing this impacts at a disproportionately sort of high level. There's also a lot of failures with traditional welfare approaches to disability. There's a concept when it comes to the existing disability policies and welfare policies that's called disability trap, which is an idea that it traps people with disabilities because of all of the barriers, traps people in poverty because of all the barriers and inability to sort of to support yourself outside of that system. There's also the sense of monitoring and control that comes with this policies. People are forced to prove that they belong to disability. They have to prove their diagnoses. So there's always that pressure that comes with the welfare policies. And finally, neoliberalism, right? This idea that we need to reduce expenditures on anything related to welfare. So this environment of austerity and privatization is another important contextual component that we need to keep in mind. Next slide. And here are some numbers. When it comes to the idea of financial security, it was identified as most urgent priority for disabled people in Canada in consultation around Canada's Disability Inclusion Plan back in 2021. And if we look at the market basket measure in 2023, sort of this measure that's used traditionally to measure poverty, percentage of working age disabled adults living under poverty was 14.4%, and it's absolutely much higher than 6.5 recorded for disabled senior population. The disabled people also live in deep income poverty. So if we look at the different levels of poverty, so that level is also much higher. As well, these estimates very likely underestimated because they don't capture the extra costs of living with a disability. So things related to equipment, assistive devices, medical treatments that people have to pay out of pocket. Next slide. And so when it comes to the steps that brought us here today, there's a few that I wanted to highlight. And I think in addition to the steps, we also want to recognize the tremendous advocacy that was done, well, by Disability Without Poverty, more specifically, and just disability community more broadly, because just talking about the bills that sometimes sort of doesn't reflect all the work that went into it by the community. So I think it's important to mention as well. And so the bill was introduced but did not advance through Parliament initially. And sort of it was introduced again a year later, and only at that point, a year later, it received the royal assent. And when the budget of 2024 came out, it was clear that the maximum that people would be getting is about $2,400 a year or $200 a month. And that too contingent on their eligibility for disability tax credit. And so, and the wider disability benefit regulations were introduced in 2025. Next slide. And so one of the important areas that we need to highlight as it relates to CDB is that it was affirmed in the act that its purpose is to reduce poverty and to support the financial security of working age persons with disabilities. And I think that's a very important thing to highlight because we need to then assess how well the policy is addressing this goal. Next slide. And so I mentioned disability tax credit, and it is a very important component of this policy. Just to give you a bit of a background, it was introduced back in 1988, but very few disabled Canadians actually qualify to receive it, and even fewer see a reduction in tax payable if they claim it. And one of the important barriers related to the tax credit is the medical fees associated with verifying diagnoses, impairments, completing the necessary documentations. So the costs, they range from $100 to $250. And so a lot of people are simply not able to afford it. There's been changes, and again, a lot of advocacy from disability community to change that. So in the very recent budget, we saw this introduction of the way to offset some of these costs. And so that's a welcome change for sure. And so just to give you a sense of what informed our work, what was leading us in terms of how we thought about this policy, there are four main areas. One is around this idea of rejecting clear-cut binaries. So it's either a social model or a medical model, right? This idea that disability is rooted within an individual and needs to be fixed, or the social model where which looks at the environmental barriers, attitudinal barriers, and that's the origin of disability. And so we're trying to look at disability in a much more complex way, while we do recognize the importance of addressing those social barriers. We also need to acknowledge that things related to embodied experiences, experiences of pain, for example, are very real for people. And so we need to make sure we incorporate that into our thinking. The other aspect of how we thought about this work is around this idea of policy failures. So policy failures is a framework that allows us to assess how successful a policy is. And it's not a yes or no necessarily response. It's more of a continuum that you can look at to understand where policy falls on that spectrum. But we found that it was very useful in terms of how we can think about a CDB. As mentioned earlier in my background, I think there's still more research that needs to be done around very real material realities of disabled people living in poverty. And I think these were the experiences that were informing our work. Next slide, please. I also wanted to mention the idea of, and I think next one as well. Yeah. So the idea of disability justice. Disability justice is very different from disability rights framework because disability justice looks beyond strictly policy approaches to how we can address the systemic barriers that people with disabilities face. And so the organization called Since Invalid developed a set of principles that aligned with this idea. And some of these principles included things like collective access, intersectionality, anti-capitalist politic, right? The idea that your worth is attached to your earned income, for example. Interdependence, kind of going away from some of the traditional, again, understanding of disability as lack of dependence or total independence. And yeah, and so disability justice allowed us to really look beyond those single access issues, right? And bring together some of these complexities. Next slide. And I think, yeah, at this point, I would like to turn it over to Sid, who will talk about the methodology we used and some of the findings.
Thank you very much, Alfiya. So I will give you a quick view of the methods we used and a bit more of a summary of the findings. So first of all, the sample that we recruited is a purposive sample, a sample of people with disabilities, not a probability sample. So we can't claim that our findings are representative of the population of people with disabilities in Canada. But what we can and do claim is that we have key informants reporting on their own experience and the experience of people that they know. We made sure, and you'll see in a few minutes, that we were successful to recruit participants from all regions in Canada. Because when we're talking about a federal policy, we need to be able to reflect that range of experience. We tried to collect data in a way which was most comfortable for participants, most in focus groups, some in individual interviews, and some in written responses for a total of 73 people. We had an advisory committee made up of 8 people with disabilities, some of them academic scholars, and some people involved in advocacy, all, of course, with the lived experience of disability. As you've got an idea from Alfiya, our approach was interdisciplinary. We weren't analyzing from the point of view of one discipline. So critical disability studies are represented, social work, the transdisciplinary field of community-based research, political science and humanitarian studies. So we are able to bring a lot of ways of viewing to the data. Finally, there is actual lived experience of disability among our researchers, and that is very useful. Next slide, please, Tracy. Okay, so I'll tell you a bit more about the sampling. It was purposive to start with. We sent information asking for participants through our networks and on social media, and we were successful in recruiting a fairly large number, such a large number that we could not accommodate all of them. And at that point, we conducted a small survey and used maximum variation sampling. So we wanted our sample to have as much variation as possible. And I'm not going to talk about this in detail, but you can see that it does, that Anglophone and Francophone participants are represented. A range of economic levels are represented, not very strongly among the wealthy, but still represented in our sample. A range of marital statuses represented, or a range of genders, and a range of experience in the workforce, right from people not employed to people working full-time. Next slide, please, Tracy. As you can see, we had participants from every region of Canada. We had various racial groups represented. Interestingly, the actual majority of our participants identified as Black. We had various living circumstances represented, right from couples to people living in roommates or living alone or residing in hospitals or institutions. And we have a range of impairments represented, as you can see yourselves. Next slide, please. So our findings are based on an inductive thematic analysis. We looked at all of the data and developed an understanding of the themes represented, which involved the whole team of researchers bringing their points of view. The first theme, which has given us the title of this session and the title of our paper, is that the benefit is inadequate. It's a maximum of $200 a month. That doesn't, for most people, meet the promise of reducing poverty. By and large, our respondents told us that it's not enough to significantly change their material circumstances. Secondly, the second issue has to do with what Alfiya told you about using the disability tax credit test. And this was seen as too narrow, too conditional, excluding too many people with disabilities, much more narrow than the definition that is in the Canada Disability Benefit Act. Thirdly, the consultation was seen as not sufficient, that there wasn't enough consultation, not enough meaningful consultation. Many of our participants were unaware or didn't know much about the Canada Disability Benefit. For example, consultation on the regulations, the report of that by the federal government included 9 categories, little information about what was said in those categories, and no information about how they affected the regulations as eventually decided. So this is not the kind of report that will encourage participation. Next slide, please. So on the first theme, here we have, you see the words of our participants. So our participants here are telling us that a single benefit is too narrow, that if we're serious about reducing poverty among people with disabilities, there need to be a range of benefits and probably a range of services. The second issue is that we have a complicated country, and both the provinces and territories and federal government involved in providing disability benefits throughout the country. So the concern is that provincial governments may claw back the federal benefit, which one provincial government has decided to do. And similarly, that provincial governments may restrain their own action in increasing benefits that they are responsible for. Next slide, please. So this slide, again, about the narrowness of eligibility. So the disability tax credit test requires that a disability be severe and prolonged. To be specific, that the applicant is unable to perform an important activity of daily living, or that it must take 3 times that it would take a non-impaired person to perform that activity. This condition has to be present at least 90% of the time, and it has to be present for a continuous period of 12 months. So this not only eliminates people with significant impairments on the severity criterion, it also means, for example, that episodic disabilities are not eligible. So again, much more narrow than the definition in the legislation. Next slide, please. And our participants told us there was not enough consultation. So the only consultation was on the regulations. Our participants, as you can see, thought that there should also be consultation on how the regulations are implemented. And they thought that people with disabilities should be consulted continuously throughout the life of the program so that the program can be continuously improved. Thank you. And now I get to pass it on to Tracy.
Thank you so much, Sid. So I'm delving into our discussion following the findings of the study, and going back to Alfiya's point earlier about one of our pieces of the theoretical model being about policy failures. We used Michael Howlett's typology on policy failures to delve into this work. So it's not a either or, yes it was, or no it wasn't, but it was that spectrum or continuum that Alfiya mentioned. And the nice thing we liked about the typology was that it includes both dimensions related to the programmatic dimensions or how it's designed, and also process related dimensions. So speaking about consultations and how these policies roll out. So we found policy failures actually on both sides. On both programmatic or design features and also process-oriented implementation grounds. So we mentioned the purpose, if the purpose of this Canada Disability Act is to in fact reduce poverty, $200, while helpful, is not sufficient to do what the stated purpose of the design of the Canada Disability Act is supposed to do. The other piece, as Sid mentioned, was the piece about the implementation of this. So the fact that the consultation, most of our participants weren't aware of the consultations that were happening, and didn't know how they could be involved in that. So that's also a failure in terms of the process piece. Um, so I'm going to move to the next slide. Also the piece about the eligibility criteria. So the fact that the CDB was tied to the disability tax credit, which I think really sort of embraces that medical model, just because it is so strict in how it defines disabilities. Sid already mentioned it restricts it to severe and prolonged disabilities, which essentially have to be extremely high thresholds, basically affecting activities of daily living 90% of the time. So very, very high thresholds for this DTC, which, as we mentioned, at the time, I think it was 2018, only about 40% of disabled Canadians were receiving the DTC. Hugely under-enrolled program. And I know the government is trying now to help, and that's why they're going to give the $150 through the new federal budget to try and encourage people to get diagnoses and whatnot. But that goes to the next point, is that first of all, not everybody has a family doctor. So trying to get in to see a doctor, it can be problematic. Some of those folks have not been adequately trained to do all the extensive paperwork that is necessary to actually document all of this. Or to even be able to diagnose whether or not somebody has a diagnosis, the full extent of that, the functional limitations of the impairment, all of those pieces. There would be an expectation that you'd know this doctor very well and that they'd be able to diagnose you, but we just are not there in Canada. So a lot of this, the DTC, really doesn't account as well for the fluidity, the mutability, the episodic nature of many impairments, or the added financial impacts that these impairments carry. So while the CDB legislation stipulated that they wanted to honor that spirit of nothing without us, I think a lot of people were saying in our study that, like I said, a lot of them were not aware. It was great that people could actually participate in the study, although I think we're also tapping into a group of people who were already connected to disability groups. So we're not getting, again, Sid's point earlier about not being a representative sample, but these are folks who are connected to community agencies and disability groups, and they didn't have any awareness of the Disability Benefit Act and the consultations and all the ways that they could be involved. So interesting. So a lot of folks did feel like there was very limited consultation. They were denied mechanisms to provide feedback, so it felt tokenistic and not fully inclusive. Nor was the consultative process fully accessible for folks. So, all the accommodations that folks might require to enable a robust participation, we're not sure that happened. Nor were there evaluative processes that would allow folks to actually evaluate the policy's efficacy. So it suggests for us a lack of commitment of the state to seriously grapple with and dismantle the power relations that result in poverty and ableism. So in terms of our conclusion, we found that Howlett's policy failure framework was valuable in giving us that continuum to kind of look at. Where does this policy fall on this spectrum? McConnell in 2015 basically said that generally speaking, that even policies that don't that are classified as policy failures have managed to produce modest successes. I think we'll have like a measure of success in that, poverty is rising very quickly and people need money. So $200, that's some groceries that you didn't have. Um, it's valuable for sure, but it's certainly not calibrated to be a resounding achievement, or certainly what I think people in the disability community were really hoping to see with this benefit. We see that it is fundamentally inadequate as a robust poverty reduction tool, and it is not, as James from Central Canada notes, enough to be a game changer. So, as we mentioned, some of the limitations for this study, while the qualitative research in itself is not meant to be generalizable, we can see some hopefully transferable findings. So again, this is not a limitation of qualitative research. It's actually very much in line with qualitative research, what it aims to do. It's not generalizable, but it does provide a lot of nuance, a lot of detail, and a lot of why, answers questions about how and why. So very, very helpful. And again, because it is, it was purposive, but we were also hoping, we were trying to get anybody across the country who fit into our criteria in terms of having, English or French. And we were trying to get the maximum variation and all of that as part of our sample as well. So it's not representative of everybody with all the range of impairments across Canada. And as I mentioned, it included people who were already connected and interested. So again, the fact that these folks were not aware of the consultations was a very important finding. So if some of the implications then, Minister Qualtrough suggested that Canada Disability Benefit would be a basic income. It clearly doesn't align with the principles of a basic income. If we think of the principles of a BIG or basic income guarantee as speaking to adequacy as number one, it has to be enough to live on, to have one's basic needs met. Autonomy, it should offer people more life choices. Dignity, there's no stigma attached to accessing it. The CDB would actually perhaps do that, provide more dignity because people don't know who's getting it and who's not, unlike other programs and charitable programs specifically. Non-conditionality, it's provided with no or very few strings attached. And universality of access. Anyone who needs it gets it. So these are the principles of a basic income guarantee. So while it meets maybe some of them, it doesn't meet all of them. So we wouldn't classify it as a basic income guarantee. It is an income supplement, and like I said, is certainly welcome at this time as the cost of living has really escalated. The other piece is this is based on the census family income. It's not based on an individual income, and basic income advocates are advocating for a benefit that would be offered at an individual level for lots of good reasons. It assumes with the census family, it assumes there's the sharing of resources. This can be problematic when people are then sort of forced to rely on a partner, for example, or somebody else in the house. And also, it doesn't help folks who are trying to leave an abusive relationship. There's lots of good research to suggest we need individual level benefits as opposed to shared family benefits. And when the regulations were announced, this was to be the start of something. It was supposed to be, okay, well, we'll start with this and then we'll improve it. We haven't really seen a whole lot of improvement over time. I mean, there is, like I said, that $150 that's been allocated in the federal budget 2025 to offset some of the costs of getting a healthcare worker to complete the paperwork for the DTC. But there's so much more that could be done. We don't know how this is going to affect insurance long-term disability policies. Will there be cutbacks due to the added increase in income? We do know Alberta has basically said it will claw back the Canada Disability Benefit. So this is also a problem. Like while a lot of income support programs, income security programs offered by the federal government, they don't go through the provinces and territories this way. So the fact that this benefit was left open for the provinces and territories to determine whether or not they would claw it back. Again, a huge equity issue depending on what part of the country you lived in. And we still don't really fully know the implications of this. So there's lots of implications, and obviously this is still fairly new. So this will be an evolving program of research. We would like to thank all of the participants who shared their stories and their experiences and insights with us. And we would also like to acknowledge the vital support, expertise, and the critical direction that was provided by members of the Canada Disability Advisory Committee, who we met with multiple times over the course of the study. So thank you to them. And that brings us to the conclusion of our presentation, and we would welcome your questions or your comments.
Thank you so much, Tracy, Alfiya, and Sid, for a very interesting conversation, and also sharing the research that you're doing behind the policy work and on the Canada Disability Benefit. I do have some questions for you, and before we start, I just wanted to reaffirm and share with you that Disability Without Poverty has been advocating for to cut red tape, accessibility, and adequacy for this benefit. So your sharing this information really resonated with me, and I'm sure it resonated with many of our viewers tonight. I'm Eastern Standard, so I say tonight in Toronto, yeah, we really do appreciate that. So some questions that I have here for you from our viewers. What reforms or complementary supports could transform the benefit into a tool for real poverty reduction? Any thoughts? And it's not addressed to anybody in particular, but it's open.
Well, our participants told us one thing, and that is that the benefit is just not high enough. When you compare it even to the MBM measure, which is Canada's official poverty measure, it is not enough to bring many people up to that measure. And the impact that's been estimated is quite small. So one thing has to do with the adequacy of that benefit. The other question would be people with different impairments experience, of course, different costs in the equipment and services to deal with those impairments. And the Canada Disability Benefit does not take account of those in any way. Tracy, Alfiya?
Yeah, I would agree with you. I mean, if the benefit is the Canada Disability Benefit Act is really about providing an income benefit, then we have to address the income piece, the adequacy of the income piece. I guess the design piece is separate. So I think we're assuming that everybody has the same needs. We could design this benefit in a different way so that it accounts for that better. You could have it so that it is more of a demo grant model where like everybody gets the same flat rate amount, and then there's top up based on added expenses. That might be a way to go. But this is where the consultation, I think, would be so important, right? To hear from folks to say what is needed in this. And my suspicion is the government had in mind what they were going to do. And so consultations is kind of the checkbox of we do this and we move on. But the adequacy piece of the benefit, I think, is a huge policy failure.
Absolutely. Another viewer asked, and I believe you have answered this question. How can governments ensure accountability so disability benefits meet the needs that they were designed to address? I know you've highlighted some things, but I didn't know if you wanted to share, or maybe Alfiya would like to add a little bit more.
I think it's for me, it's the recognition of the lived experience as a valuable source of knowledge. I don't think we're there yet in terms of recognizing it. That's why we keep on treating it in a very tokenistic way. So there needs to be a shift in terms of how this knowledge is valued. To me, that's an important mind cultural shift that needs to happen. And yeah, just to kind of add to the previous question, I agree. The piece around the extra costs of assistive technology. I'm a prosthetic device user, and that's a huge added expense for me that's, not covered by insurance or anything else. And a lot of my friends with spinal cord injuries talk about having to purchase catheters that they rely on. So this all of these things, they I think contribute such valuable nuanced information that it's just not reflected. That nuance is not there, and I think that's where we need to get to. That yeah, embracing that nuanced experience.
Thank you, Alfiya.
Another aspect is that the Act actually does contain the provision that Canada has to meet its internationally agreed upon human rights obligations, which a number of us recommended, and I think it's great it's in the Act. Now the question is, how will that be assessed? And I think that's one area to bring some pressure. It would be interesting if the responsible minister had to report to Parliament annually about what has been done to make sure that those obligations are met.
Absolutely. Thank you, Sid, for sharing that as well. One other viewer asks, what role can advocacy networks play in pushing for a stronger, more inclusive benefit? Any final thoughts there?
I would say that, yes, we've got the benefit, we've got the act. We know we have to provide this. I think we say this is a good start. Now we actually have to make it robust, right? So like we now we have an act saying we have to do it. It has to actually reduce poverty. So yeah, so putting pressure, I'd say, to say we need to have regular meetings with the government to have some evaluation of the process and evaluation of the policy and what it's doing and how does it meet our human rights obligations, I think is really, really important, like Sid mentioned.
And I think this is a moment, since there's a foot in the door with this benefit, this is the time for disability advocacy organizations, which were very prominent in getting this legislation passed. Poverty advocates, human rights advocates, to come together in a focused advocacy campaign with government, because there is a foot in the door, and now it's a matter, if you'll excuse the expression, of pushing that door so that it opens wider and wider.
Absolutely.
The other thing I hope happens when something's in legislation, it opens the possibility of asking courts to intervene. So I hope there's some action about the federal government not really meeting the obligation in the bill. And Canadian courts have been reticent often to deal with the policy function of governments. But I would think for its educative value alone, that might be quite worthwhile.
Very interesting. Thank you for your comments, Sid and Alfiya and Tracy. We are concluding for today. Thank you to our panelists. A heartfelt thank you on behalf of Disability Without Poverty to Sid, to Tracy, to Alfiya for your panel. It was very insightful on the research that you're conducting, and we are just very grateful for you being here today and sharing your information. At this time, I would like to thank our viewers, but before we go, I would like to also call upon my colleague who is on stream A, Amanda Lockage from Disability Without Poverty. Hi, Amanda. Hello.
Hi, Sabrina.
We're here.
This
Wow.
wraps our first symposium. There are
Wow.
people that I see in the gallery that were here with me this morning when the sun was rising on the West Coast, and the sun is now setting on the West Coast. So we had a full day of so much heart and community and just wonderful panels. I can't wait to go back and watch everything I couldn't see on stream B while I was on stream A. So thank you for joining us. Thank you for your participation today. Thank you to the staff of Plan Institute, Liz, Solana, Kyer, Rachel, Stephanie, all the rest of you. Thank you to the amazing staff at DWP, Omar and Amy and Jessica, Sabrina, Janet, Rabia, our board members who joined us today as panelists or moderators, Michelle and Liz and Minu, and those who couldn't be here today, Ali and Luca. We want to thank Shane for all of his incredible support, specifically for the work that he did on every single video that we have up on our site for the symposium. Thank you to the accessibility teams. We know it's been a long day. We appreciate you. And most of all, thank you again to the moderators, the panelists. You can find our third annual disability report card, disability poverty report card on our website, disabilitywithoutpoverty.ca. And this day of panels, Stream B and Stream A, will be up on our YouTube channel in the coming weeks. If you want to catch something you've missed or rewatch something, there's lectures, there's those poster presentations, there's so much, and we're so grateful. And Sabrina, I'm going to pass back to you.
Sounds great. Thank you, Amanda, and thank you to everyone. I echo the same sentiments. Disability Without Poverty would like to thank our following organizations for their financial support: the McConnell Foundation, the Maitrey Foundation, the Toronto Community Foundation, and the Hamilton Community Foundation. Thank you on behalf of Disability Without Poverty. To our viewers, allies, friends, advocates, thank you. We couldn't have done the work without you for today. We couldn't do the work that we do continuously on a daily basis without you. Just to leave this note, there's still so much work left to do. As you can see from the panels today, and the insights and the conversations that we're going to take away, there's still much more work that we have to do. We are grateful that you are here alongside us. Thank you so much, and we look forward to seeing you again soon. Take care.